CRNAs, we are high risk for exposure to the coronavirus. And you might be a CRNA, you might be a CRNA student, and you might be saying to yourself, what's going on? What should I expect? What should I be aware of? And how do I protect myself? So I'm just going to go through some simple strategies, as well as to give you some little updates on what's going on with CRNA practice during this huge epidemic. So definitely keep watching. My name is Christine, and welcome to a new video. If it's your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing and hitting the bell so you don't miss anything. You must be thinking, what's going on, with CRNA practice? What are CRNAs being, we are area management experts, hemodynamic monitoring experts, and what is going on with CRNA practice during this huge epidemic? I definitely have experienced changes in my practice, as well as changes that are possibly going to expect to happen in the next couple months, maybe even year. So I'm here to fill you in on what I've experienced more specifically, and what you can do to prepare yourself if you are currently a CRNA, as well as if you are, if you're in CRNA school and you're thinking about clinicals. So let's talk all about that. Yes. So we are currently in a period of life where it's a huge pandemic with the coronavirus. A lot of people are experiencing, depending on the area you live, more cases of this coronavirus. It's a very new virus, and it's spreading rapidly, and there's still a lot of learning that's going along with this and research with this virus. And of course, depending on the area you're living, in big cities, there's higher exposure rates. And of course, with CRNA practice, things are changing, and definitely things are kind of, turning and becoming different, definitely with practice. Of course, the basics of anesthesia is the same. Of course, we're more up to date. There's a lot of evidence-based practice with our practice in general. With this virus, we're more concerned with, exposure rate. CRNAs, to think about it like this, we are airway management experts. So think about this too. There are patients who come in for example, giving you an example, an elective surgery. They have to get their appendix removed. Well, that's actually emergency surgery. But let's see, a gallbladder procedure, or they're coming in for a cataract. And saying these patients have no symptoms, for example, and maybe they have the coronavirus. Not saying that they do, but there's a possibility, right? And because some people don't even have any symptoms of this virus. Come in for a procedure, we are in their airway, depending on the procedure. Well, cataracts, maybe not, but gallbladder procedure, we have to intubate these patients. It's an open airway, aerosol of liquids. We're in patients' mouths, as well. We have to extubate them and suction them, depending on the person, right? So we are actually high risk for contracting the disease. Not that we will, but you're just at risk. And as a CRNA, it's definitely concerning to think about, what can I do to protect myself? Because at the end of the day, I love what I'm doing, and we need anesthesia providers out there to take care of patients. No matter their situation, no matter what diseases they have, I'm here to help. I'm here to give back to my community. And so things are changing. So currently, in my institution, my chief CRNA is very proactive in making sure we are safe, and making sure that, at the end of the day, that we are protected. So there's a shortage in mask, N95 mask, gloves, supplies, definitely hand sanitizers. The nice thing about my institution that I feel that we're pretty much have a backup of things. But with time, naturally, things will become more of a shortage. So the nice thing is that our head CRNA, where we're currently working at, we were given N95 masks that we can use. We still have access to masks, hand sanitizers, hand washing. The most cheapest way to keep yourself clean is washing your hands with soap and water. And a lot of people forget that. Yes, you can use hand sanitizers, but you can wash your hands with soap and water. But think about this too, as a CRNA, depending on your institution, there are no sinks and soap in the operating room. So thinking about this, you go ahead and intubate a patient, and you are in there in that whole environment back where your anesthesia machine is. There's nowhere to wash your hands. But I always do this thing where I put multiple gloves on. So whenever I'm manipulating any type of airway, I take a glove off, take another glove off. And then when I'm done, I hand sanitize my hands, as well as take like the Clorox, depending on the device, or there's another type of alcohol-based that's more safer and depending on the equipment. And I wipe everything down, and I wash my hands, constantly changing my gloves and trying to make sure my environment, anything I touch, is clean. As well as when I'm intubating a patient, as well as I'm extubating a patient, I wear an N95 mask. And to protect myself, make sure I have a really good seal and make sure it's the size that fits me appropriately. Because of course, depending on the institution you work at, they test you, making sure it's the right size for you, make sure you have the right size, as well as you have access to the N95. But there are some places where there's no access to it. I've heard, depending on the place, I watched online, people are wearing like scarves. It's tough, shortage of supplies is tough, and you want to protect yourself. And I don't know the research base in regards to wearing scarves, but comment below what you've heard and what you've seen, and definitely want to hear what your knowledge base about, wearing scarves as well to protect yourself with the mask, or, what you guys have seen in your institution in regards to protecting yourself from this virus transmission. So another thing to talk about is now what is the changes that's going on in my institution versus many institutions. So depending on the hospital you're working at, now things have been changing. Like at my institution, we are currently just doing emergency cases or urgent cases, for example, that need to go because, at the end of the day, patients need care. So in that situation, we are doing those cases, as well as elective cases. That case is not really an emergency. It's not going currently, but that's always changing. So now you got to think about this too. Now the caseload is less. So a lot of people are concerned, of course, their expectation of working a certain 40-hour week may be cut in half, or it's much less. That's why I believe with anything, it's very important to save and have a budget, and also have a backup supply of money in case something happens, you're prepared. But of course, not a lot of people have that, that luxury to do that. So I definitely, I'm feeling for you. And definitely comment below what's been going on with you, with your institution, in regards to, the amount of hours you're working. But definitely I am seeing a cut in hours. But for me, at the end of the day, I'm very happy to have a job, as well as I'm happy to be able to help others and focus in on that, as well as being with my family. So yes, that is definitely changing. And also with students, for example, with CRNA students, as well as being a preceptor, that is also changes. A lot of students are not coming to clinical because their programs are not, more on a safe side, in the sense that they don't want, students to be exposed. And so a lot of things are going on with online. Like, for example, their lectures, if they were meeting with the class on, in school, it now has converted to being online. So it's more of a homeschool approach with the education nowadays. Another thing that I've been hearing, and I'm not experiencing that yet, but get to remind yourself that you are an ICU nurse. You have experience in the ICU, and that's a nice thing about CRNAs, is that we have experience in the ICU. We know how to medically manage patients, as well as airway management techniques. So depending on the location you're working and depending on the hospital you're working, the future might change in regards to your practice. Now, yes, so maybe your cases are, much cut in half, for example, in the operating room. But they might have, I don't know for sure what's going to happen, but there might be a thing where CRNAs are airway experts and helping in the ICU, helping medically manage patients in the ICU. Especially, we are very strong skill set in intubations. So maybe we be the people who will be going for emergency intubations, code teams, helping respiratory therapy with, ventilation management. I don't know for sure. Maybe CRNAs might even go working in the ICU and help with patients in the ICU, which is, at the end of the day, we're here to help, and we're here to help others and to give back to our community, give back to in any way we can. Of course, some CRNAs, don't feel comfortable because they believe that, they want to just do, specific to anesthesia. But I don't know what's going to happen in the future, and these are things that have been coming up and I've been hearing. And depending on, like, for example, you may be thinking like malpractice, are we covered? Well, depending on the malpractice, you know, for example, the AANA, that's the Nurse Anesthetist Association, and I think I've been hearing that, you know, we are covered in the ICU, in the operating room, and all different type of settings. So that's definitely something that might be happening and transitioning with anesthesia practice. We might be going into ICU, might be going to different areas and seeing it in that sense. See our practice changing more in that sense. So there's a lot of things that's going on and changes, and at the end of the day, I love saying end of the day, but you know, we got to keep our mindset open. I know there's always changes that's happening. We just got to be resilient and just roll with it and see what's going on, see how things are transitioning. So definitely comment below, because I just have I have some information about it, you know, but I want to hear your experience and what you've been seeing and what you've been hearing, so we can share it with each other. And just to go through some couple quick tips that I've been trying to do, as well that you can do to protect yourself. You have access to N95 mask. Make sure you have the appropriate size for you, and if you have access to, definitely use it during intubation and extubation if you can. You know, wearing masks, of course, you know, gloves, a lot of hand washing, of course using hand sanitizers to clean your hand as often as possible, and also clean down your anesthesia machine and anything that's your surroundings in the operating room. Keep as clean as possible, because naturally we touch things and we don't realize that we're touching things. Even the remote, when you're increase and decrease the bed, for example, in the operating room, you're pressing those buttons. Anything you think you're touching, your monitors, just try to keep it as clean as possible. And of course, look at the CDC website, see what they're doing and what they're recommending, because they are more up to date on research based, what they have been seeing. So definitely follow those guidelines on the CDC website. As well as the AANA, they also have some recommendations for CRNA practice and more up to date on malpractice insurance. So definitely check out those websites specifically, and those type of associations, because they'll give you more up-to-date information, as well as depending on your state, legislation and all different type of things are changing constantly. So whatever I'm saying today might change in the next couple of weeks, next couple of months. So definitely keep yourself up to date on your practice, on your specific area, as well as following the CDC and the Nurse Anesthesia Association as well. So if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of these videos over here, and I'll see you in the next video.
Click the like button and subscribe.
All right, see you in the next video.
Bye. Keep in touch.